What is tennis elbow? Tennis elbow or lateral epicondylitis is a condition affecting the arm, typically the dominant arm. It is characterized by pain in the region of epicondyle. What causes tennis elbow? The usual cause is overusing the arm, often related to work sports. Carpenters, factory workers, musicians, and cashiers who use their hands repeatedly can have this problem. An injury, such as from lifting something that's too heavy, can also cause it. Who is at risk? Individuals who smoke, is obese, or adults ages 45 to 55 are at risk of experiencing tennis elbow. What are the signs and symptoms of tennis elbow? Pain with resisted wrist extension, pain with gripping activities, decreased grip strength, and tenderness at ECRB insertion into the lateral epicondyle. And do you need to consult your healthcare provider? If the following signs such as hard to move your arm, lump or bulge, pain or difficulty from everyday activities, reddish or swollen elbow are present, consult your physician. How is tennis elbow diagnosed? Your healthcare provider will make a diagnosis by taking your medical history and physical examination. The following maneuvers exacerbate pain at lateral epicondyle: persisted wrist extension with elbow fully extended, persisted extension of long fingers, maximal flexion of the wrist, and passive wrist flexion in pronation causes pain at the elbow. They can also order some tests or X-ray to rule out other diseases with similar symptoms. MRI can also be done for a better view. How is tennis elbow treated? Short-term relief may be provided with rest, ice, physiotherapy, or topical or oral NSAIDs. If other therapies fail, glucocorticoid injections may be used. This condition is typically self-limiting over a period of several months, but lifestyle or occupational modifications may be helpful in preventing recurrence. Operative treatment can be considered for recalcitrant cases with symptoms that last longer than 1 year. What is the consequence if tennis elbow is not treated? Non-operative treatment for tennis elbow is successfully effective. However, this can lead to complications when not treated. Complete tendon rupture is the most serious complication of tennis elbow. The treatment of this complication would involve surgical repair. How can we prevent tennis elbow? We can prevent this by using proper equipment in playing tennis. Consider the size, weight, and grip appropriate to you when choosing a racket, and use dry balls when playing. Adapt to good habits like stretching before taking part in intense physical activities. It is also important to rest the hand when any pain or stress is experienced.